Hello, and thank you for joining us for our Facebook Live discussion on COVID-19. Experiencing a pandemic can be overwhelming, confusing, or scary. But by focusing on the facts about the 2019 novel coronavirus, also known as COVID-19, and prevention, we can eliminate some of the stress of this situation. I'm Elizabeth Van Camp, and I'm a member of the University of Iowa Healthcare social media team. And I'm here with Dr. Teresa Brennan, Chief Medical Officer at UI Hospitals and Clinics, to discuss the facts about COVID-19, some of the myths and misinformation out there, and what to do if you or someone you know becomes sick. Thank you for joining us today, Dr. Brennan.
Thanks, Elizabeth. Glad to be here.
Yeah, before we begin, this video is for informational purposes only. If you feel sick or are concerned about your health, we encourage you to contact your primary care provider or schedule a video visit to speak with one of our providers. And we'll include the link to our video visits page in the comments below. So let's get started with the basics, Dr. Brennan. Can you remind us what is COVID-19?
Sure. So COVID-19 is the disease that's caused by the novel coronavirus that started in China and now has spread throughout the world. So coronaviruses have been around for a long time. There's actually 7 different coronaviruses. 4 of them actually cause basically the common cold and really aren't that serious. Can be really distressing, but not that serious. MERS and SARS are both other novel coronaviruses or coronaviruses. And then this one is a brand new virus.
Great, thank you for that, that reminder of what this is. So our next question is, what do we know about how this virus is spreading, and do we know how long it can live on surfaces?
Yeah, because it's a new virus, there's a lot of things that we don't know and that we're learning about each and every day. What we do know or believe strongly to be true is that it isn't passed through the air. So some viruses and bacteria can be passed through the air, things like measles or other things that are very contagious. So we're fortunate that this is a droplet transmittable disease, which means that it's passed when someone coughs, and droplets fall to the surface, may fall on people, and then you can pick them up and actually infect yourself by touching your face. So droplet transmission. How long it lives is still a little unclear, but we believe that it's at least hours. The surface it's on probably has an impact. So surfaces like plastic, it may live a little bit longer. Cardboard maybe a little less. It's at least hours, and there's some suggestion that it may live days. Most important, brings up what we're going to talk about, I think, several times today, is that you need to wash your hands, don't touch your face, and try to stay away from people who are sick. And we'll talk about, I'm sure during this, about social distancing.
Yeah, that leads wonderfully into our next question, which is, how are you recommending people stay healthy right now?
Right. So, during every influenza season, we talk about washing your hands. And most people who wash their hands actually don't do it properly according to the World Health Organization, right? The World Health Organization says that the proper way to wash your hands is to lather up for 20 seconds and then rinse. Washing hands as frequently as possible, and if you don't have soap and water available to you, use hand hygiene gel. So that hand hygiene gel or hand sanitizer should have at least 60% alcohol. And the key here is to do it as frequently as possible. Thinking about the surfaces that we touch, whether it's our desk, a table at home, a doorknob, those surfaces could have had someone who maybe just coming down with the virus walk by and cough on them. So really making sure that you are washing your hands frequently. The second thing is to not touch your face, because you can infect yourself by touching your face. And it's really that area, eyes, nose, and mouth. If you can wash your hands and not touch your face, your risk goes down significantly. And then it's keeping away from people. And when this started, we talked about keeping away from those who are apparently sick, but now it's really about keeping distance from everyone. So we talk about this concept of social distancing. And what that really means is just making sure that there's space between you and any other human being that you're with. So that space ideally should be 6 feet. So if you can put out your outstretched arm, and the person you're talking to can put out their outstretched arm, and you can't touch each other, then you're within that 6 feet social distancing, good space.
That's a great visual. I think we posted it to our social media actually earlier this week of of you and another person putting out your arms. And so that's a good way for people to remember to stretch out your arm. And if you're that close, you're too close.
Yep. If you can touch each other, you're too close.
So with social distancing, I think one of the questions a lot of people have are they understand that they should be staying home as much as possible and maybe not going to the stores often, but can people go outside? I think that's a concern for a lot of families with kids. Is it safe to be out?
Great thoughts. When you go outside into the open air, the likelihood of you touching surfaces goes down significantly. If someone coughs, those droplets hopefully will go elsewhere. And so going outside not in crowds, of course, is a really good idea. So it's also good for your mental health because you're not inside, and it's good for your physical health to get some good activity. So yes, go outside, but stay close to home. Stay in places that aren't populated by a number of other people. And if we're walking down the street and you see someone, just take a little, diversion and stay within that. Make sure you're outside of that 6 feet.
Great, that's good info. So what should someone do if they are experiencing the symptoms we've talked about or are concerned that they might have COVID-19?
Yeah, really important to isolate first and foremost. So if it would be very unusual for someone to start having the symptoms of COVID-19 and to have really severe symptoms that would require them to come to the emergency room. So I'm going to really work under that premise. So if you have symptoms, you wake up in the morning and you have a bit of a fever and a new cough, stay away from your family. So, don't go and have breakfast with your family. Don't give your kids a hug. Try to distance yourself. Then you should call. So calling first does a couple of things. We here at the University of Iowa have a video screening clinic where either by video or by telephone, individuals can be screened for the symptoms. It allows us not to have people being exposed unnecessarily. And it allows us to, in a really pretty rapid way, get people into the right clinic if they need to be seen by a provider or they need just a test. So call first.
Great. So if you're just joining us, we are here with Dr. Teresa Brennan, Chief Medical Officer at University of Iowa Hospitals and Clinics, and we're discussing COVID-19. Please comment with your questions in the comment section below, and we will try to get to as many of those as possible. So our next question is about flattening the curve. It's something that we hear on the news, we see on social media, but a lot of people still don't know quite what it means. Could you explain to us what flattening the curve means and why it's important to do so?
Yeah, there's a really nice visual that may be good for people to go online and look for because that is really helpful for some people who are visual learners. But basically what flattening the curve means is to try to decrease the spread so that we don't have this huge peak in patients who are getting infected and ultimately needing hospitalization, so that we have the healthcare capacity to take care of people. So if we can contain and socially isolate people, keep them from, keep social distancing for sure. And then, as you said earlier, don't go to the grocery store if you don't need to. Don't go out shopping. Don't have social gatherings because the potential for spread could be there. That allows us to decrease the spread and not have those peaks that will really overwhelm the healthcare system.
And this is important even for people who are maybe don't know they have it yet or are asymptomatic too, right? Because even if they don't have symptoms, they could be spreading the virus if they're out in the community.
We think it's possible that clearly we know that influenza can be spread when someone doesn't have symptoms. So the day or so before someone develops symptoms in influenza, you can spread the virus. Coronavirus is different, and we don't know exactly, but we believe that there's likelihood that there's a possibility for spread when someone doesn't have symptoms. The extent of that spread is probably far less likely than if someone does have symptoms, but you should practice social distancing even with people that don't have symptoms based on the idea that asymptomatic spread can occur.
Great, thank you for that insight. Do we know how long someone could have the virus before showing symptoms?
I don't think we know enough about the virus to know that.
Okay.
What we do know, I
Yep. Go
give
right
you
ahead.
So what we do know is that when someone comes in contact with someone who has COVID-19 and ultimately then develops the disease, so they've been exposed and now they develop symptoms, that time frame is about 5 days. It can vary from 3 to up to probably 10 days, but the average is about 5 days.
That's really good to know. So with people still needing to go to the grocery store, when we do have to go do those things out in public, is there anything you recommend doing so we don't bring germs home? Should we be wiping down the cart handles? Should we wipe down our groceries when we get home? What are your recommendations?
Good question. So I'll tell you that I didn't used to wipe down the carts. Never did that. I do it now. So when you go to the grocery store, some people will wear masks and gloves. I'm not sure that has any great benefit. People tend to, when they wear gloves, they tend to have some false sense of security that I'm wearing gloves, so I'm fine, and then they touch their face. So I'm not sure that that's necessary or even a good idea, but that's your own personal choice. But surely you should wipe down the cart. Now, when you go to the grocery store, you're going to pick up things that have been sitting on a shelf for a while, and you don't really know who's been around or what could have happened to those things before you got to that place in the aisle. So I would say that for sure you should be washing your produce and doing an extra good job at it. The second thing I would say is that if you're bringing home non-perishable items, I'd probably let them sit and let them, just sit there for a day or so before you take them out and put them in your shelves. And then anytime you touch anything that's coming from the outside, you should then wash your hands.
Okay. Very good advice. Similarly, a lot of people are trying to support their local economy by continuing to get food takeout. Is that something that you can give advice? Do we need to be concerned about someone else preparing our food? Is that something that we should continue doing, or is that really something we should be wary of?
Yeah, I mean, the preparation of food is a little tricky because the virus is pretty sensitive to heat and can be killed pretty easily. But the packaging could have been touched with people that potentially had the virus. So what I would recommend is if you're going to order out, order it from a place that you know and trust. Probably now isn't the time to try something new. And then it's just a risk benefit.
Sure. So with the warmer weather arriving with spring, do we know if that will have any kind of significant impact on the spread of the virus?
Boy, we sure hope so. We hope it like influenza that goes away when the weather gets warm. I don't think we know enough about this virus to know. We're hoping that that's the case. We do, though, know that it has spread in places that are very warm. I mean, in Florida and Louisiana and Georgia, they're having outbreaks right now. We're not sure, but
Okay.
we're hoping for it.
Yeah. Well, hopefully that is the case. So our next question is, how long do you think this need to stay at home is going to last?
Yeah, I told someone today that if I had a crystal ball, I'd be a pretty popular person. I don't think we know, but what we do know is without containment, meaning if we don't social distance and we don't isolate in our homes and prevent the spread of the virus, it will continue to go on for a long time. So it really is about preventing that spread. It's likely to be with us for weeks, at least.
Okay. So in terms of this staying home and kind of isolating ourselves, do you have any tips for people adjusting to this, especially in terms of their mental health?
Yeah, it's hard.
Mm-hmm.
We're human beings, and most of us really enjoy that personal interaction. I think it's hardest for people that are quite social, and in particular, people that live alone. We do have the luxury today of having a lot of capability of interacting with people by technology, just like now, right? So when we did this Facebook Live, a couple weeks ago, we were in the same room. Now we're not. But we're still able to communicate. And I think that's the one thing that I would tell people is, this is a scary time. People are worried. They might be panicky. They certainly are fearful of what's going to happen to me or my loved ones. or maybe the economy, or all sorts of things can cause people to have symptoms that they normally don't have with regard to mental health. And so keep in touch with people, talk to people, talk about your worries and your fears. Sometimes we worry about things that really aren't, we don't need to worry about. And when you talk to other people, that may become more apparent. I think we have established a number of things here for our employees at the University of Iowa, because we recognize that COVID-19 is causing people more worry and fear than they are used to. So we have a cope line, a group that really helps to cope. That's what it's meant to be, cope with things that they're not used to dealing with, employee assistance. And we've actually added a hotline for our employees that's manned by one of our psychiatric staff 24 hours a day, just to make sure that people have access to things. So don't be afraid to talk to your healthcare providers, your primary care physician. If you need to see someone in the psychiatric field, do it. It's a good thing to get good care.
That leads us nicely into the next question, which is, what should I do if I need medical care or I already have an existing appointment and it hasn't been canceled? Do you have any?
Yeah, I think many of us have been thinking about COVID-19, all the time for the last many weeks. And I'm sure that many patients are thinking that too. We have lots of patients that have chronic medical conditions that they really can't put on hold. They need to be seen. So if you need to be seen, you should be seen. For us, what we're doing is calling our patients and finding out how they are. I had clinic this morning, and we called my patients last week. Some of them needed to be seen and some of them didn't. Those that needed to be seen, if they had to come in, we would bring them in. But those that didn't need to be seen, we did a telephone consult with. And that actually worked really well. So if you have to be seen, just take precautions. Come in, go straight to the clinic, wherever you are, wash your hands, don't touch your face, keep social distancing when you're walking through hallways, and try to be there as short a time as possible. Probably now is not the time to visit the gift shop, electively, although our gift shop is still open for our employees and people that have to be here. But, go directly there and go directly back to your car. As much as you can create barriers between yourself and others during this time, particularly if you have medical illnesses, because you may be at higher risk of having a bad outcome should you get COVID-19, depending on what your other medical illnesses are. So just be thoughtful and careful.
Great. Well, if you're just joining us, we're here with UI Hospitals and Clinics Chief Medical Officer, Dr. Teresa Brennan, and we're talking about all things COVID-19. So I want to give a question that we're receiving on Facebook, and a couple of people have asked it. Should people be washing their hands after bringing in the mail or their newspaper, or should they be washing clothes that they're buying online and getting delivered? How careful do we need to be with things that we're receiving in the mail?
Yeah, I think you just don't know. And the uncertainty can make people uncomfortable. I would say mail, that I would put it aside if you don't need to open it and let it sit, so that if there is any potential that it had contact with anyone that has COVID-19, that there's a chance for that virus to die before you have to take care of it. No matter what you do, though, you should definitely wash your hands afterward. So anything that's coming into your home, you should try to take good care and wash your hands. I even had a question yesterday during one of our forums about your shoes. So, when you come into your home, and I would say this particularly for anyone who's been in a hospital, but also if you've been, at the grocery store or even walking in the street, take off your shoes at the entrance of your home. Anything that you can avoid bringing into your house is a good idea. You don't need to get too fearful about it, but just, wash your hands and yeah.
Yeah, so just being cognizant of where you've been and just being careful. It doesn't hurt to just be a little bit more aware of that than we might normally be.
Right. Absolutely.
Right. So there's still a lot of misinformation out there about this virus, especially on social media. Can you explain to us again what the difference between influenza and COVID-19 is, so people really understand that there's a difference there?
Sure. I mean, they're viruses in different families. That's the first thing. The similarities are there as well. I mean, they cause the same sort of symptoms. So someone with COVID-19 might feel like they have influenza, and so that's a little bit challenging because you can't tell the difference necessarily when you get one of those viruses. A couple big differences between COVID-19 and influenza is COVID-19 is more transmissible, meaning that when one person gets it, they have a likelihood of giving it to more people. So that's not good. The second is that COVID-19 has a higher likelihood of causing great harm to people. We do know that influenza can cause and has caused tens of thousands of deaths throughout the world. And it tends to be non-discriminatory, meaning that people can die of all ages. It does tend to cause more severe conditions in people that are older and people that are very young. This virus tends to really select people who are much older and who have other medical conditions, diabetes, high blood pressure, heart disease, lung disease, kidney disease, liver disease, etc. Those are the people that may have worse outcomes with COVID-19. Similar to influenza, but the ages are different for COVID-19. And the risk of people dying from it is actually higher than it is for influenza.
Okay, so some important differences there. I appreciate you sharing those. Can you tell us a little bit about the COVID-19 tests that we'll be conducting here at the hospital?
Sure. So we're really fortunate to have a great pathology staff and director of our pathology lab to have gotten the test in. It's really empowering to be able to test people because if you're negative, that's really reassuring. And if you're positive, then you know that you need to go home and you need to isolate and a little bit about what to expect. So the test is done via a swab, similar to the flu test, where they swab the back of your throat. It's a little uncomfortable. Our patients don't really like it very much. And then it's sent to the lab where they run a PCR test and can tell if the virus is present or not. The turnaround time for our lab is about 4 to 6 hours. They run them in batches, so it can be less or more depending on when it's sent. But with the ability to do it here in our own hospital, we've been able to test more people, which is a good thing.
It's a very good thing. And similarly, are we conducting any research about the virus, and are we working with any other hospitals in this battle against the virus?
Sure. So Dr. Stanley Perlman is a researcher in issues of viruses and virology, and he's been active at the University of Iowa for many, many years. He and his team are participating in research trials presently, and there's other things going on as well. Regarding our participation with other hospitals, Iowa is a great place, and we're really fortunate to be able to come together in these times of emergency. So we've been working very closely with the Iowa Department of Public Health and the governor, but also are working with hospitals in our area to try to make sure that when someone thinks of a good idea, we should share it. And we've got a lot of really great, innovative people that live in Iowa. So it's been really good to have partnerships throughout the state, but particularly for us locally with Mercy in Iowa City and the 2 hospitals in Cedar Rapids.
Great. So a couple people have asked if you have any advice for pregnant women at this time, things that they can try to do to keep themselves healthy.
Yeah. It's a scary time, right? Because you're worried about yourself and more worried about your baby or babies. And so really important that pregnant women do exactly the same things that we're asking everyone else to do. And in addition, to stay in close contact with their obstetrician or their doctor who's taking care of them and the babies. Just getting those frequent interactions, whether it be coming to a clinic or actually having a phone conversation, is really important. We feel like pregnant women probably have some degree of suppression of their immune system. It's not unclear, but they may be susceptible to things that they wouldn't have been when they weren't pregnant. And so we certainly want them to take good care and try to avoid getting the virus.
Great, thank you for that. Some people have asked on on Facebook, and it's something I've seen circulating as well. Do we know what kind of physical changes we're seeing in people after they've had this virus? You know, we've there's been reports of lung capacity being reduced or taste and smell being affected. Could you give us any insight about that?
Sure. Actually, this is something we've been talking a lot in the last few days about. We have put into place a monitoring system here at the U where a patient that comes to us and has a test and it's positive, so they now have COVID-19 disease. We actually give them a call with one of our nurses, giving them a call to tell them, how they need to isolate, what to look out for, what would make them want to come in and be seen because it would mean that they were getting sicker. And then in the higher risk population, particularly those over 60, one of our providers is actually calling them daily and having either a telephone or a video visit with them. And we've been able to learn a lot from this. The issue of taste is really interesting. So what we're hearing from our patients is that their taste is really altered, and they feel like whatever they put in their mouth tastes like dirt. And that makes them not want to eat or drink. And when you're facing this virus and you have high fevers, the fact that people aren't drinking can be very detrimental. And so for those who may have had a diagnosis, even if you're feeling good, make sure that you're eating and particularly drinking. Keeping hydrated is so important. We also know from watching them that maybe the first few days they feel bad, but they do okay. So they have lots of body aches. That's a very common thing that we hear. Fever is there in some, but not in all. Most of them have a cough. Some of them might have diarrhea as well. Then after that first week, they either tend to get better or they tend to get quite a bit worse. So the course of the disease is really variable. But if you have a diagnosis, what I hope you take from this is, even though it seems horrible to be drinking, it doesn't taste good and you don't want to, you really have to force yourself. Consider it a job.
That's so important to know. So that led me to one of our other questions that people have asked is so much has changed in the past few weeks. And I know you've already touched on a few things that we now know that we didn't know the last time you and I chatted, but is there anything else that we've learned in the last couple of weeks that you think is important for people to know?
I think one of the things that we're starting to see here in the United States that we didn't really know in China, we really thought that the only people that got very, very sick were people that were elderly. And we are seeing that younger people can get very sick. And so I think it's really important to recognize that. When I talked about the symptoms earlier, I talked a little bit about cough. But what happens when people get quite sick is that this virus tends to attack their lungs, and they have great trouble breathing, and then their oxygen levels go down, and then some of them have to actually go on a ventilator. So we've learned that though it is more common for the elderly to have bad outcomes, that it can happen with younger people as well. I think we're also learning more about transmission. I think we're learning more about therapies. There are a number of therapies that are out there potentially that may have some impact on patients. I mean, this is a virus, so there's no drug to kill the virus itself that we can give patients. But we can do supportive therapies. And so research trials are ongoing, and we're participating in some of those as well.
Great. The last question we have time for today is, what are some of the ways that people can help support those who are on the front lines?
Yeah, so this outbreak is hard for everyone. It's hard for patients and their families who are worried about getting it. It's also really hard for healthcare workers because they are knee deep in it. People that are in healthcare can't go an hour without it being on their mind. And so anything that we can do to help the mental state of our healthcare workers is really important. We've gotten lots of great support from our community, and our community has been so important to us. But even small things, I have gotten so many texts or emails or just a thought from a friend, someone that might be nearby, somebody that's far away that I haven't heard of in a while, just hope you're doing well, thinking about you. Those sorts of things really go a long way when people are under a lot of stress. So if you have a friend who's a healthcare worker, send them a note because I'm sure that they will very much appreciate it. We've also had lots of donations and offers from the community to help. Healthcare workers tend to like food, right? So we see a lot that families will bring in food. Right now, we're asking you not to bring in food because we don't want shareable food because there's potential for, people to transmit the virus if food is shared. But people are offering to help us make things. One of the things that we feel is very important for our healthcare workers to have is something called a face shield. It basically is something plastic that just goes over the front of the face. You can wear it with or without a mask, and it protects people from, those droplets when you're interacting with people. We've acquired a number of masks by ordering them, but they're in short supply, and so we've had people that have offered to make them or to donate them, and we're very happy for that. Other things that people have offered that right now we don't feel like we have a need for are homemade masks out of cloth. We're not sure how well they work, and so we're actually not encouraging our staff to wear them because we just worry about that false sense of security. But yeah, we're actually starting a campaign to thank our healthcare workers and also thank the community that we live in because it's been such a wonderful partnership. Iowans are great, and we're really blessed to be a part of their community.
Yeah, it's been a great show on social media, in person. You walk by people's houses and they've got window displays up and chalk art just to try to encourage people. And it's not a situation any of us wish we were in, but I agree, it's been great to see the support that's outpouring for everyone in the community.
Absolutely.
Yeah. Well, thank you so much, Dr. Brennan, for sharing your expertise with us again today.
Absolutely. Stay safe.
You too. And thank you to everyone who tuned in. If you tuned in later in the broadcast, please make sure to go back and watch the whole video so you can get all the great information Dr. Brennan provided us today about COVID-19. And stay tuned to the UI Healthcare social media accounts and our website, uihc.org, for more updates about COVID-19 as we have them. Remember, please wash your hands often and practice social distancing. Thank you for watching.
Thanks so much.